Today I will talk about hyperpituitarism. The pituitary gland and hypothalamus are so closely interlinked that diseases of the pituitary gland involve the hypothalamus, and dysfunctions of the hypothalamus cause secondary changes in the pituitary. The pituitary gland is involved in several diseases which include non-neoplastic, for example inflammations, hemorrhage, trauma, infarction and many other endocrine diseases, and neoplastic diseases. However, functionally and morphologically, diseases of the pituitary can be classified as below, each of which includes diseases of the anterior and posterior pituitary and the hypothalamus, separately. 1. Hyperpituitarism. 2. Hypopituitarism. 3. Pituitary tumors. Hyperpituitarism is characterized by oversecretion of one or more of the pituitary hormones. Such hypersecretion may be due to diseases of the anterior pituitary, posterior pituitary or hypothalamus. For all practical purposes, however, hyperfunction of the anterior pituitary is due to the development of a hormone-secreting pituitary adenoma, and rarely, a carcinoma. For each of the hormonal hyperfunction of the anterior pituitary, posterior pituitary and hypothalamus, a clinical syndrome is described. A few important syndromes are as follows. A. Hyperfunction of anterior pituitary. 3 common syndromes of adenohypophyseal hyperfunction are gigantism and acromegaly, hyperprolactinemia and Cushing's syndrome. Gigantism and acromegaly. Both these clinical syndromes result from sustained excess of growth hormone, GH, most commonly by somatotroph, GH-secreting, adenoma. Gigantism. When GH excess occurs prior to epiphyseal closure, gigantism is produced. Gigantism, therefore, occurs in prepubertal boys and girls and is much less frequent than acromegaly. The main clinical feature in gigantism is the excessive and proportionate growth of the child. There is enlargement as well as thickening of the bones resulting in considerable increase in height and enlarged thoracic cage. Acromegaly. Acromegaly results when there is overproduction of GH in adults following cessation of bone growth and is more common than gigantism. There is enlargement of hands and feet, coarseness of facial features with increase in soft tissues, prominent supraorbital ridges and a more prominent lower jaw which when clenched results in protrusion of the lower teeth in front of upper teeth, prognathism. A few associated features such as TSH excess resulting in thyrotoxicosis, and gonadotropin insufficiency causing amenorrhea in the females and impotence in the male, are found. Prolactinemia. Prolactinemia is lactotroph, PRL secreting, pituitary adenoma, also called prolactinoma having excessive production of prolactin. Occasionally, hyperprolactinemia results from hypothalamic inhibition of PRL secretion by certain drugs, for example chlorpromazine, reserpine and methyl-dopa. In the female, hyperprolactinemia causes amenorrhea galactorrhea syndrome characterized clinically by infertility and expression of a drop or two of milk from breast, not related to pregnancy or puerperium. In the male, it may cause impotence or reduced libido. These features result either from associated inhibition of gonadotropin secretion or interference in gonadotropin effects. Cushing's syndrome. Pituitary-dependent Cushing's syndrome results from ACTH excess. Most frequently, it is caused by corticotroph, ACTH-secreting, adenoma.